Alrighty, I am starting my patient encounter for week 2, the neurological system. This is my blank sheet of paper.
Hey.
Miss Adams?
Yeah.
Hey, my name is Glenn Adams. I'm a physician assistant student here to take care of you today. This is me washing my hands. How are you?
Good. How are you doing?
Good. What brings you in today?
I've been having headaches.
Alrighty. Can you tell me a little bit about those headaches?
They start in my temples and they kind of happen in the front of my forehead as well.
Okay. And when did you first notice those headaches?
At least a week ago.
A week ago?
Yeah.
So Saturday?
Yeah.
And when you do get those headaches, how long are they lasting?
It can be up to 4 hours.
Okay. And are you getting multiple headaches a day?
No.
Just the one?
Yeah.
All right. And how many times a week do you get the headaches?
Probably like every other day.
Okay. That sounds tough. I'm sorry you experienced that pain.
Yeah.
And can you show me exactly where? I know you said your temples and then the front. Okay. Does it go all the way around your head like a baseball cap?
No.
Just the temples in the front? Alrighty. And can you tell me anything else, any other characteristics about the headache?
No.
No? This just feels like tension. Does it throb?
No.
Do you do anything that makes it feel better?
I try and drink more water. Get less screen time.
Okay, so screen time makes it worse.
I think so, yeah.
It's very observant of you.
Thank you.
You're welcome. Are there any associated symptoms?
No,
When you get the headache, you don't notice anything else happening?
not really.
Okay. Does the pain radiate anywhere?
No.
And have you noticed any patterns with the headaches?
No.
All right, and if you had to rate the pain on a scale of 0 to 10, 0 being not painful at all and 10 being the worst pain you've ever felt, where would you put that pain?
Like 5.7.
Okay.
Yeah.
All right. And have you had previous episodes where you got these headaches so frequently?
No, it's pretty new.
No. Okay. All righty. Now I'm going to ask you some questions, just yes or no questions, considering the headache that you've been having. So yeah, you've been having a headache. Have you had any troubles with swallowing?
No.
No. What about balance?
No.
Coordination?
No.
Okay. What about dizziness?
Mm-mm.
Have you had any changes in your walking pattern?
No.
Any head trauma?
No.
What about memory loss?
No.
What about numbness?
Mm-mm.
Do you get any sensation of like pins and needles tingling?
And my feet sometimes.
Okay. And when you get that, do you notice it with the headache?
Not necessarily.
It's not related to the headache.
Doesn't seem to be.
Okay. Do you have seizures?
No.
What about a loss of consciousness?
No.
Do you have trouble forming words?
No.
What about tremors?
No.
Paralysis?
No.
Any weakness?
No.
What about an altered mental state?
No.
No. Alrighty. And just in general, do you have a fever?
No.
When you get the headache? What about chills?
No.
Fatigue?
No.
A general sense of unwellness?
No. I mean, it's painful, and I feel unwell in that regard, but
Do you feel like you just need to like lay in bed and kind of like
sometimes,
yeah. And is that how can you describe that to me?
I just want to lay in bed.
Is it every time you get the headache you also feel this way?
No, it doesn't always get to that point.
Just occasionally you feel that way?
Yeah.
How many times a week would you say?
Once.
Once a week?
Yeah.
And when you do feel that way, how long does it last?
An hour.
Okay. Have you had any appetite changes?
Mm-mm.
What about generalized weakness? Anything else?
No.
No. Changes in your weight?
No.
Okay. Right. Now I'm going to ask you some questions about your past medical history. Have you ever been hospitalized?
No.
Never?
I had surgery.
Okay, what was that? Yeah.
When I was 5, I had my tonsils removed, and when I was 16, I had my wisdom tooth removed.
Okay. And do you know where you got those surgeries done?
I think SMH, Slidell Memorial Hospital.
Okay. And other than that, you haven't had any other hospitalizations or surgeries?
No.
Are you up to date on your immunizations?
Yes.
You got a flu shot this season?
No.
No?
No.
Are you on any medication?
No.
Nothing prescribed?
No.
Nothing over the counter?
No.
You don't take Advil when you get headaches?
I don't.
No? Are you on any supplements or vitamins?
No.
Nothing herbal?
No.
Do you have any allergies?
Some seasonal allergies
Okay.
in the spring, and I'm allergic to mangoes.
And when you get those seasonal allergies, how does your body react?
Sinus infection type stuff. My throat will kind of dry up, and my nose just feels stuffy.
Okay. And do you treat it with anything?
No, I'll gargle Epsom salt sometimes and do like breathe in steam over the stove, but other than that, no.
Okay. And which season are you noticing these allergies?
In the spring.
Spring. And then you said you have an allergy towards mango. What happens when you do come in contact with mango?
My eyes get swollen and my lips get swollen and itchy.
Do you ever lose the ability to breathe? Feel like your throat's closing?
No.
Do you take anything to manage that?
I don't.
You just avoid mangoes?
Yeah.
Okay. All right. Do you have any allergies to animals? Any
No.
other medical allergies? No. Okay. Now I'm going to ask you some questions about your social history, and I just want to preface this with everything I'm asking you is to treat you better. There's no judgment here. So, do you use tobacco?
No.
No e-cigarettes?
No.
Do you drink alcohol?
Yeah, sometimes.
Can you describe that to me?
I'll have 1 glass every 2 to 3 days a week.
Glass of what?
Wine.
A glass of wine 2 or 3 times a week?
Yeah.
So when you are drinking, you're just having about 1 glass?
Yeah.
Okay. And do you do any recreational drugs?
No.
What's your diet like?
I don't eat beef. I eat poultry and seafood for meat. I avoid dairy, and I eat plenty of fruits and vegetables.
That sounds like a good diet. Do you monitor your salt intake?
I don't put salt on much.
Okay. And do you exercise?
Yes.
All right. What kind of exercise do you like to do?
I jog, bike, and do calisthenic work.
Cool. How often do you do that?
3 to 5 times a week.
Awesome. I bet that makes you feel real good.
It does.
Good. And are you currently employed?
Yes, I work at Trader Joe's.
Awesome. What do you do there?
Everything.
Can you elaborate on that at all?
Yeah, I'm usually on the night shift, so that's unloading the truck that means like lifting heavy boxes.
Okay. And do you notice any like patterns with when you're working and your headaches?
Not particularly.
Okay.
No.
Do you have insurance?
Yes.
Yes. You can afford your medication and your medical needs?
Yeah.
Okay, good. And what is your current living situation?
I live with my sister and our friend.
Cool. And are you sexually active?
Yes.
Do you use protection?
Yes.
And have you been screened for STIs?
No.
Alrighty, Miss Adams. Yeah. I just have a couple more questions for you. So, are both your parents still alive?
Yes.
How old are they?
58 and 60. Mom's 58, dad is 60.
Alrighty. Do you have any kids?
No.
What about siblings?
Yeah, I have 3.
Can you tell me about them?
My sister's 28, my brother's 26, and my other sister is 23.
Alrighty. And in regards to your family and yourself, has anyone been diagnosed with high blood pressure?
No.
What about diabetes?
No.
High cholesterol?
No.
Has anyone had a stroke?
No.
What about a heart attack?
No.
Does anyone have heart disease?
No.
And does anyone have cancer?
No.
Okay. Alrighty. So what I'm hearing from you is that you've been having these headaches for the past week. It's about every other day. They last about 4 hours. Screen time makes it worse. You haven't noticed any patterns with work. And water makes it feel better, but that's about it as of now. And the pain is about a 5.7 out of 10. Does that sound about right?
Yeah.
All right, Ms. Adams. Well, thank you for coming in today.
Thank you.